evidences, all these researches nowadays, they are showing that earlier loading is very good when it comes to either ACL or any ligament where the loading joint is there. So here the role of dynamometer, again, it is like a powerful tool when you move on to the second phase. Every week they are seeing the difference after the rehab process. They are saying, yes, they are ready to go. When you give them a definitive data, ki, yes, you are working fine. That is a kind of psychological support also to return to their game. Again, when just the initial phases, when we talk about, it's like controlling the pain and swelling and extension, good extension. As I said, ki extension should be there. The quadriceps control is very important when we talk about the recovery. So quads activation is very important. And weight bearing, again, weight bearing is a surgeon's perspective. Nowadays, many of the surgeons, they are asking to take load on the joint, to take load on the ligament, so that helps to recover them well. But again, it's a surgeon's perspective. In my setup, my surgeon, he actually gives a time for like 0 to 2 weeks that they should not take weight on the limb, and then they progress like the third week onward, partial weight, and then we can move on to the full weight bearing. So, but all these evidences, all these researches nowadays, they are showing that earlier loading is very good when it comes to either ACL or any ligament where the loading joint is there. Again, interventions, yes, interventions are there. You have to start cryotherapy or electrical stimulation. Yes. So again, the progression criteria is extension. The flexion range should be like 120 degrees. SLR should be good. The weight bearing, the weight bearing pattern should be good. No hip hikings, no valgus is there. You have to make sure that, knee is not going into valgus. So the progression criteria, again, the goal should be pain should not be there on the vast scale. Extension is full, swelling is minimal. Now, again, when we see the quadriceps strength, so moving on to the next stage, the quadriceps strength, if it is like from the normal extremity, if it is good, so we can move on to the phase. So here the role of dynamometer, again, it is like it makes it very powerful tool when you move on to the second phase. The progression criteria is, again, you've got your limb symmetry index more than 70%. There is no valgus, no dynamic, because most of the time when we are giving them some rehab plans, so the knee, they are not able to maintain the knee in the proper aligned position. So we have to make sure there is no valgus. We have to work on the hip muscles so that the valgus is not there. Again, the interventions in these phase are closed chain exercises. Initially, we have to stick to the closed chain exercises, step up and up, step downs, of course, glute exercises. Cycling is, again, you can put the cycling thing, but again, depending on the player, or depending on their pain scale, depending on their how much is their swelling, whether there is like they are able to move or not, it all depends on the athlete, whether they are able to move. Any exercise plan, if you are planning for a player, it does not depend ki we just have to, there's a written thing that they have to follow. It is again very subjective when we are planning. So they have to see whether they are able to, we have to see whether they are able to move on to the next phase or not. Again, when we come to strength and control phase, it's like starts from anywhere from week third to week 10th. So we are working more on the quadriceps, all the drills. We are working on squats. Again, squats is a functional pattern. So we can go for mini squats, to goblets, to single leg stances, balancing. Now, this is a phase when we have started like anywhere from sixth week onward. We can start loading the joint. We can start, the single leg stances. We have to work on that. So we can work on, how they are moving. We can use the steppers in our exercise plan. We can start in the like 8th week onward. We can start with plyos. We can start with, agility drills. Now, when we talk about return to sport criteria, so again, the limb symmetry index should be almost 80%. And when we talk about the hop test is again a very important marker when we are asking the athlete to return to sports. So single leg hop or the lateral hops or 6 minute timed hops. So all these hops, but the ultimate thing is when we are planning the return to sport, the quadriceps and hamstring ratio, the quadriceps and hamstring muscle strength should be good. Limb symmetry should be minimal, like 80%, when we are planning to. But then when we talk about, just the criteria based, but then there is a term called ligamentization. So ligamentization of the graft, which has been repaired, that is also an important point to, consider. But the ligamentization is like somewhere for some a person, it starts from, 6 months to it takes 2 years to get a good, strength in the graft. So we cannot ask the sports person to wait for that much time to return to sports. There should be psychological readiness also, that they are, the fear, the anxiety, they can, re-injure themselves. That is very much there. So when we have a data, when we are giving them this feedback that their strength is so good, like from the normal extremity, the quadriceps is working fine. Also, when we talk about this, fit knees, we get all the squats, dynamic squat test is there. Then the gait thing is there. How is the knee, the proprioception? How are the knee proprioceptors working? That is also there. So when we give them our data, and their progress, when they see the progress, uh, every week they are seeing the difference after the rehab process. They are seeing, yes, they are ready to go. When you give them a definitive data ki yes, it is, you are working fine, that is a kind of psychological support also to return to their game. Again, when we talk about like sports specific drills, like running and power, it starts somewhere from 10 to 16 weeks. We talk about the agility sports specific, again it's like 4 to 7 months. But usually when we uh, uh, think about returning to sports, 6 months to a year of rest, like not a kind of rest from the actual game. They can start practicing, they can start practicing from 6 months onward. They can start game practicing. They can go to the grounds. In fact, right from the first day, if they are going to the ground and they're seeing their friends working out, so that gives a psychological support also. So yes, they can anywhere from 6 months to 9 months they can start playing. But before that, they have to clear few criteria. The functional skills, like the LSI index should be good, their quadriceps to hamstring ratio should be good, their hopping quality should be good, and also no pain. Like whenever they are performing their all these exercises, any pain should be contained within 24 hours. If after exercise, pain is very normal. Like if he is coming to us that after exercise the pain has increased, so we can talk to them that any pain which is there till 24 hours and then is it is subsiding after proper rest or doing some ice thing. And if it is like contained, then it is good. The pain, any pain which is contained after 24 hours is good. We can start the injury prevention drills also, because already they have injured. Like there's a very good FIFA 11 program is there. Then there is program plus. Then we can see the hamstrings, Nordic hamstring protocol from Aspetar. These are very good protocols and they are free online. So anyone can access those. And with the data that we have, the good HQ ratio, we have good limb symmetry index, and we can see it, so they can proceed further to their games. So now when we talk about returning to sports criteria, the strength should be like 95%. HHD should have good quads symmetry. The hop test should be symmetrical more than 95%. So I think, and movement quality should be good. No pains, no nothing, like whenever they are walking, there should be no giving away. And all, of course, the psychological readiness. There are psychological questionnaires which we can use. So yes.